Basically, any healthcare worker that works in the hospital medication circuit is at risk of exposure to hazardous drugs. The medication circuit is the pathway that drugs follow, that starting from shipping and receiving, to storage, to drug preparation, to administration, all the way to its eventual disposal. Adverse health effects associated with exposure include reproductive toxic effects like spontaneous abortions or difficulty conceiving. There's also genetic damage as well as possibility of developing cancer as well. So in my opinion, the global challenge that healthcare workers face when handling hazardous drugs is a lack of awareness of the risks, not adhering to best practice guidelines, and general indifference. So they're aware of the risks but don't seem to be very concerned. In my opinion, there's a number of reasons why there's indifference amongst healthcare workers. The first is because there hasn't been a documented case of a worker being compensated for a disease claim associated with exposure to hazardous drugs. And the second thing is that there's just a lot of other health and safety issues that are found in healthcare, such as ergonomics or patient handling, as well as workplace violence, which are much more pressing concerns. With regards to policymakers, they understand now that there is a need to have more detailed requirements for safe handling of these hazardous drugs. However, they've been slow to adopt best practices as well as make changes to the occupational health and safety regulations. So in terms of raising awareness, it's just important to educate any workers who are working within the hospital medication system that they may be at risk of exposure and how they may be at risk of exposure. With regards to risk assessment, it's important to quantify the amount of drugs that might be found on surfaces, and this can be done through wipe sampling, and numerous kits have been developed by researchers to collect samples off of surfaces. Once they're aware of the risk, it's important to mitigate the risk, and this can be done through a combination of various control measures, starting with engineering controls such as closed system drug transfer devices, then moving on to administrative controls such as written policies, and then lastly through personal protective equipment. So there have been a number of best practice documents that are currently available. They've been developed at both the national as well as international level by pharmacists, oncology nurses, occupational health and safety professionals, as well as a group of all three. These best practice documents are quite lengthy, but the gist of them include the following. Is to conduct a risk assessment, education and training of workers, implementation of control measures such as engineering, administrative, and personal protective equipment, specific procedures for certain processes such as sterile processing as well as non-sterile processing, cleaning protocols, and environmental monitoring. The organization needs to determine which best practice they wish to follow. This could be any one of them or a combination of them. Then they need to do a gap analysis to see where they stand with respect to these best practices. And then in order to implement these changes, they need to develop a change management process for their organization to follow in order to comply with these best practices. This includes engaging with workers, developing a communication plan, ensuring the necessary resources are available, having a rollout strategy with timelines, and delegation of roles and responsibilities.